Hello, good afternoon. This is BBC News with me, Ben Brown. Well, we'll be live from Downing Street in just about half an hour's time with the latest government briefing. First, though, our headlines. And there's been a major breakthrough in the fight against coronavirus. A cheap and easily available drug has been shown to reduce the risk of death by a third amongst patients on a ventilator.
This is a drug that's very affordable, it's widely available, and we've shown that it can have a good impact on improving survival in quite a large proportion of hospitalised patients.
A government U-turn. Children in England will now get free school meals over the summer holidays. It follows pressure from the footballer Marcus Rashford and senior politicians.
If I had the power to do so, I'd put Marcus Rashford in number 10 running policy, because he's a pretty incredible guy.
The cost of lockdown. The number of UK workers on company payrolls fell by more than 600,000 in 2 months. The number of people claiming unemployment-related benefits more than doubles. Boris Johnson says plans to merge the Department for International Development and the Foreign Office will unite aid with diplomacy. But 3 former Prime Ministers say it's a mistake. And New Zealand records 2 new cases of coronavirus. Both had come from the United Kingdom, ending 24 days of no new infections there. Hello, good afternoon. In half an hour's time, we'll be bringing you today's coronavirus press briefing from Downing Street. It's led today by the Prime Minister Boris Johnson. First, though, a look through today's developments. And coronavirus-related deaths in the UK have fallen to their lowest number since the week that the lockdown was announced. That's according to the latest weekly data from the Office for National Statistics. Taken together with similar data from Scotland and Northern Ireland, the figures also show that there have now been around 64,500 more deaths than would normally be expected in the UK since the coronavirus outbreak began. A further 233 people across all settings in the UK have died in the last 24 hours after testing positive for coronavirus. That takes the total number of COVID-19 deaths in the UK to 41,969. Now, in what scientists are describing as a major breakthrough, a cheap and widely available steroid has been found to save the lives of seriously ill coronavirus patients. The government says the UK has now stockpiled 200,000 courses of dexamethasone. About 1.3 million children in England will now be able to claim free school meal vouchers during the holidays after a campaign by the Manchester United footballer Marcus Rashford. The government had previously insisted it would not award free school meal vouchers in England outside of term time. The number of workers on UK payrolls plunged by more than 600,000 between the months of March and May. That's according to the latest official figures. And meanwhile, the number of people claiming work-related benefits, which includes the unemployed, was up a record 126% to 2.8 million. We'll bring you more on all those developments shortly. First, though, let's get more on that reported breakthrough in the treatment of people who are seriously ill with coronavirus. Peter Horby is Professor of Emerging Infectious Diseases at the Nuffield Department of Medicine at Oxford University, which conducted that research. He's been speaking to us as he made his way to the Downing Street briefing.
I'm as delighted as anybody. It's fantastic. We've been running this trial for quite some time, for 3 months, and it's fantastic to have some good news. This is a drug that's very affordable, it's widely available, and we've shown that it can have a good impact on improving survival in quite a large proportion of hospitalised patients. We showed a benefit in patients who required oxygen on the ward, with about a 20% reduction in the risk of dying, as well as a reduction in the rate of death in those on mechanical ventilation. And that was an even bigger reduction. That was a 35% reduction in the risk of death. We were surprised by the result. We were obviously hopeful that the drug would have a benefit, which is why we trialled it. But we were quite staggered by the size of the benefit, so it's really fantastic news.
Well, let's talk more about that fantastic news as the professor was describing it with our health correspondent Michelle Roberts. I mean, it really is quite a breakthrough, but just to be clear, this is a very old drug. It's been around for decades.
It has. I mean, that's good news as well, because it's been used for a long time. We know that it can be used safely. Also, it's very cheap, so there's no big one pharmaceutical company that owns it and will make more money out of it, in that respect. So experts are saying it costs about £5 in the UK for a course of this treatment for a patient, and $1 elsewhere around the world. So really accessible. There's lots of stock of it. It can be made quite easily as well. So this is really positive news.
And why is it so effective in treating people who are seriously ill with COVID-19?
So most people who catch coronavirus recover well on their own. Some people need to go to hospital, and those who get very sick may need help with their breathing, with oxygen or on a ventilator, and it's those patients that this drug can help. So sometimes when the body's trying to fight off the infection, it goes into something called a cytokine storm. It sort of goes into overdrive, and that causes some damage to the body as it tries to fight it off and fails. So this drug is a steroid, and it dampens down that inflammatory response, and that's how it's helping these patients who are really, really sick with coronavirus.
Yeah, and as the search goes on for a vaccine, which everybody hopes will be successful, in the meantime, this could be really key in reducing the number of deaths.
It could. I mean, they estimate that UK alone, so far we've had nearly 42,000 deaths. Up to 5,000 of those might have been avoidable if we knew this at the time. I mean, it's lovely to have hindsight, isn't it? But it's positive news. It can really make a difference. So for every 8 patients that you treat with this drug who are on ventilators, you might save an extra life, which is really quite dramatic.
And listening to the professor there who was part of these trials, I mean, they're really surprised, aren't they, staggered in fact, by how effective this drug has been.
They are. I mean, normally you would wait for more trial results, put it in a peer-reviewed journal, get other people to pore over all the research. But obviously we're working at breakneck speed with coronavirus, trying to find treatments. And it was clear from the results they had, very clear, that it was making a big difference, which is why they've put out this information quite early so that people can act on it. It is, a very exciting development.
Yeah, and we're going to hear more about it at the Downing Street briefing at 5 o'clock from the professor we were just hearing from, also from the Prime Minister. Thank you so much, Michelle Roberts there, our health correspondent. Now, Boris Johnson has confirmed that the government will now fund school meals for eligible children in England over the summer holidays. Comes after pressure from the footballer Marcus Rashford, who was himself a recipient of free school meals when he was growing up. Those eligible will get 6-week vouchers to cover the summer break. Number 10 says the one-off decision is based on what it calls an unprecedented situation, and it also said the Prime Minister welcomed Marcus Rashford's contribution to the debate around poverty. The Labour leader, Sir Keir Starmer, said it was, in his words, another welcome U-turn from Boris Johnson. Well, after hearing the news, Marcus Rashford himself put out this tweet. He said, "I don't even know what to say. Just look at what we can do when we come together. This is England in 2020. And in a later statement, Marcus Rashford said this. He said, "This was never about you or me. This was never about politics. This was a cry out for help from vulnerable parents all over the country. And I simply provided a platform for their voices to be heard." He also said, "I stand proud today knowing that we have listened and we have done what is right. There is still a long way to go, but I am thankful to you all that we've given these families just one less thing to worry about tonight. The well-being of our children should always be a priority." So that statement in from Marcus Rashford himself. And Jane Keane-Smith is a self-employed hairdresser in Worcestershire who has 4 children who are all eligible for school meal vouchers. What's your reaction to this U-turn by the government?
Over the moon that they've decided that it would be a worthwhile thing to do. Wonderful that Marcus Rashford could put his point forward because he's been there, he's lived it. It's very different when you've got plenty of money, but if your children come to you and ask you for food and you can't give them something, it's the worst feeling as a parent in the world that you can't offer them a meal. So overwhelming, just over the moon. Unfortunately, this is only going to help us in the shortfall, but hopefully then we can move forward with some other things.
And just give us an idea for your family in particular, what kind of difference is this going to make in the coming months?
A massive difference. So I've got 4 boys, 3 of them teenage. They just basically would eat me out of house and home. So it's going to help me massively. We've been relying on friends and family as well. And we're really lucky that our school are part of FareShare, so they help us a little too. But this means that now I have some money because I'm on a 0 income at the moment. We're a shielding family. So even though as a hairdresser, I can go back to work the 4th of July, I can't do that because we are shielding poorly people in the family. So it's just taken a little bit of pressure off.
Are you surprised that there was so much pressure on the government to change tack on this? Are you surprised that it's taken them a while to change the policy?
Yes, but I suppose they've got to look at it all ways, really, because it's to do with finance as well as many other things. But I've spoken to people who run our summer clubs for the children, and they are unable to do that. So with no provision at all available as an alternative, I don't think they had a choice. I think we were in a position where they had to do something. So I'm just grateful that they did decide to change their minds.
And as you say, Marcus Rashford, when he was campaigning on this, he really spoke from the heart because he had been there as a schoolboy.
Yes, and I hope that in a way my children can look at him and realise that there is a way out of these things. It's not always going to be like this. So hopefully he's also someone to look up to for all these children that are in this situation, that receive the free school meals, and they can see that you can get out of this situation with a little bit of help.
All right, really good to talk to you, Jane Keane-Smith,
Thank you.
self-employed hairdresser in Worcestershire. Many thanks.
Thank you.
And just before Number 10 made that announcement that free school meal vouchers would be extended in England, Scotland's First Minister Nicola Sturgeon announced an extra £12.6 million for councils in Scotland to fund free school meals through the summer holidays.
Free school meals are currently being made available to around 175,000 children across Scotland, either within local authority and early years premises which are still open, or more often through direct cash payments, supermarket vouchers, or the direct supply of food or meals. I can confirm today that this provision will be extended right throughout the summer holiday period. We know families are under considerable financial pressure just now, and free school meals are a vital help to many, but they're also really important to the health and well-being of children. So we will provide £12.6 million in funding to local authorities to enable the continuation of free school meals during the period from the end of June to the start of the new term in August. The funding will be allocated in a way that allows councils, as many of them currently do, to coordinate school meal provision with wider support that they make available to families. In addition to that, we're making £15 million available to councils to maintain some of that wider support, in particular the support for food, which is currently available for people in severe poverty, people who face other barriers to getting food, and people who are being asked to isolate under the new Test and Protect system. Our support for those who are shielding, which I should say comes from a different budget, is also, of course, being maintained. But at a time when, as these employment figures today show, many families will be finding it much harder than normal to make ends meet, I hope that these announcements provide some reassurance during an extremely difficult time.
Nicola Sturgeon, their First Minister of Scotland. Now, the number of workers on UK payrolls fell by more than 600,000 between March and May this year. Meanwhile, the number of people claiming work-related benefits, which includes the unemployed, more than doubled to 2.8 million. The early estimates reflect the impact of around 6 weeks of lockdown in which large parts of the United Kingdom were shut. But economists say the full effect on employment will not be felt until wage support schemes end in October. Our business correspondent Sarah Corker reports.
No sector is immune from this economic emergency, but hospitality is one of the biggest casualties, with more job losses to come.
If we did close one of our 3 sites, the whole business would collapse as soon as we open. We reckon within 3 to 4 weeks cash would drain out.
After 12 weeks in lockdown, restaurant owners Peter and Elaine now have £250,000 of unpaid bills. So they're closing their Manchester branch permanently. 31 people are losing their jobs.
You're telling them a big part of their life is gone, or is about to go, and nothing prepares you.
No. We've got really close relationships with the staff. The staff are not just names, they're people we've grown really close to.
I'm sure there's been tears, haven't there?
Yeah.
Loads.
Yeah.
So there's a lot.
The restaurant's manager, Isaac, knows the job hunt will be incredibly tough.
The reality that we are facing now here in Lunia, it has been replicated already in other places with other talented managers. And we need to understand that the competition is going to be quite fierce.
Today's figures show the most challenging jobs market for decades. This graph shows payroll data, including redundancies, retirement, and those whose contracts have ended. Look at the drop between March and May. 600,000 people lost their jobs. And there was a dramatic fall in job vacancies, plummeting around 60%.
I think by the summer, there's every chance we'll have 3 million people unemployed. And it'll be the top priority for government to be setting out how it can restart hiring, can support employers to keep more people on.
The outlook would be much bleaker if it wasn't for the government's furlough scheme, subsidising the wages of around 9 million workers. But the fear is it could simply be delaying redundancies. And today's figures also suggest the young are likely to be the hardest hit.
You just think, why couldn't we get help? Why would nobody help us?
When Shearing's holidays in Wigan suddenly went bust in May, Holly and 2,500 others lost their jobs overnight. She says she was at the start of her dream career.
I think I cried for the rest of the day. It was just devastating. I felt gutted and getting a bit upset now because it was just it was a bit more like, oh my God, this actually happened. Numerous things went through my mind: financial support, being able to help my mum. Me and my boyfriend had just started saving for a house. It's like start all over again.
The hospitality and travel industries will take years to recover. The number of people claiming work-related benefits has hit 2.8 million, a 27-year high, and it's predicted to rise further in the months ahead. Sarah Corker, BBC News.
The Office for International Development is to merge with the Foreign Office. Boris Johnson said the Foreign Commonwealth and Development Office would enable Britain to make the most efficient use of the UK aid budget, which is the third biggest in the world. Former Prime Minister David Cameron said merging the two departments was a mistake. Speaking in the Commons, though, Mr Johnson said ambassadors will lead the work of their individual country.
We must now strengthen our position in an intensely competitive world by making sensible changes. And so I have decided to merge DFID with the Foreign and Commonwealth Office to create a new department, the Foreign, Commonwealth and Development Office. And this will unite our aid with our diplomacy and bring them together in our international effort. DFID has amassed world-class expertise, and all of its people can take pride in how they have helped to transform the lives of hundreds of millions of people across the world. To select but a few examples, they have striven to protect millions of children across the world from polio, which is now on the verge of global eradication, and they have paved the way for millions of girls to attend school for the first time in countries such as Pakistan, as I've seen for myself. They've done their utmost to ease the suffering in Syria, and in Sierra Leone they were central to the defeat of an outbreak of the Ebola virus. And all of this amounts to the finest demonstration of British values, following in the great tradition of the country that ended the slave trade and resisted totalitarianism. And it's precisely that ambition, vision and expertise that will now be at the heart of a new department, taking forward the work of UK aid to reduce poverty, and that will remain central to our mission. The Foreign Secretary will be empowered to decide which countries receive or cease to receive British aid, while delivering a single UK strategy for each country, overseen by the National Security Council, which I chair. Those strategies will be implemented on the ground by the relevant ambassador, the relevant UK ambassador, who will lead all of the government's work in the host country.
Prime Minister in the Commons a little earlier. Now, more borders across Europe are opening up as countries ease their lockdown restrictions. Yesterday, Belgium, France, Germany and Greece lifted border checks. And today, Austria has lifted restrictions at its border with Italy and is ending quarantine requirements for more than 20 European countries, although restrictions do remain in place for travellers from the United Kingdom. Well, our correspondent Bethany Bell is at the Brenner Pass on the border between Austria and Italy and sent us this report.
Austria's border with Italy is open again. There's still a partial travel warning for Lombardy, the region with Italy's worst outbreak of coronavirus. But freedom of movement is returning. Border checks at the Brenner Pass are gone for the first time in 3 months. European governments are keen to get business and tourism moving again. But the summer holiday season is still looking uncertain. Austria has ended quarantine requirements for more than 30 European countries, but not for Britain. The government here is worried about infection rates in the UK. France and the Netherlands also insist on quarantine for travellers arriving from Britain. And now there are signs that Spain may do the same when it reopens its borders in a few days' time. Yesterday afternoon, the British Embassy in Madrid tweeted that people travelling from the UK wouldn't have to self-isolate in Spain. But last night, that advice appeared to have changed.
We will be checking what the UK will be doing, and we will be in a dialogue with the UK to see whether or not we should be introducing reciprocity as they have different measures than the rest of the European Union.
Hundreds of German visitors arrived in Mallorca yesterday, the first tourists allowed into Spain since the borders were shut in March. British tourists may be able to join them if London and Madrid can resolve the quarantine issue. But for now, the UK is still warning against all non-essential travel abroad. Bethany Bell, BBC News.
And meanwhile, New Zealand, which hadn't recorded any coronavirus cases for almost a month, has now confirmed new infections in 2 people who had recently arrived there from the UK. Both are women who are from the same family and who had travelled there from Britain, and they were given special permission to leave quarantine in order to visit a dying parent. Charlotte Rose reports.
These new cases will come as a blow to the country, which has been held up as a beacon on fighting COVID, with just 22 deaths from the virus. It had gone 24 days with no new infections, the result of an early lockdown and strict border controls which remain in place, with only citizens and essential workers allowed in. The 2 women, one in her 30s, another in her 40s, had travelled to New Zealand from the UK, stopping in Doha and then Brisbane en route, but it's not clear where they picked up the virus.
They didn't have any unwell family members or friends in London that they can think might have had an infection that they could have been infected by. So it's possible they picked up the infection either in the UK or at the airport or potentially on one of the flights.
They were a week into the mandatory fortnight quarantine in an isolation facility in Auckland, but were allowed to leave on compassionate grounds to visit a dying parent in Wellington, 400 miles away. They travelled in a private vehicle driven by another family member, who's now at risk of infection, as well as all the passengers and crew on board the flights they took, who are all being traced and contacted. In a video update, the Prime Minister says that although the women followed all the rules, the testing regime had failed.
There is already an expectation that no one leaves quarantine until they have completed their 2 weeks and been tested. Of course, that was our expectation already, so that is where there is a failure in this case.
As a result, the country is pausing all compassionate leave and introducing compulsory testing every 3 days for those returning home. New Zealand became the latest country to lift all restrictions on its citizens, seeing the return of sport and even Black Lives Matter protests over the weekend. But as things start to return to normality, it knows the fight against COVID is a marathon, not a sprint. Charlotte Rose, BBC News.
Now then, throughout the lockdown, many of us have been inspired to pick up a tennis racket because it was one of the first sports to have restrictions lifted and deemed safe to play. Let's discuss how the world of tennis can capitalise on this. We're joined, I'm glad to say, by the tennis coach and former international player Judy Murray. Judy Murray, thanks so much for being with us. I've enjoyed playing quite a lot of tennis, not very well, it has to be said, during the lockdown. But has there been a huge boom, do you think, in tennis playing during the last few weeks?
Yeah, I think there has, as you say, because it was one of the first sports that was allowed to open up, and we're a little bit behind England up here. So you're more open, able to do more doubles, more group activity than we are at the moment. But it's a huge opportunity to get new people into the game, or to get people back into the game who may have hung up their rackets some time ago, because everybody was desperate to get out and be doing something in the fresh air.
And how important is it, I mean, to play not just tennis, but to get exercise, really good exercise pretty much every day during this very difficult time?
Yeah, I think it's incredibly important for your mental health, and of course for keeping fit and keeping active. And I think that particularly for families have got used to learning together and doing things together during the lockdown. And I think tennis is the #1 family sport. So I think it's a perfect opportunity for clubs and park courts to welcome families into the game and put on activities that families can join in.
Is it your impression that enough courts are open, that that council-run courts as well as private courts are being opened up?
Certainly, clubs have been able to, and I couldn't tell you too much about park courts. Certainly in Scotland, some of the park courts are going to be opening up from this Thursday. That's us going into phase 2. I think England may be a bit ahead of us, but I guess it depends on staffing and policing and so forth. But the club houses, of course, are not able to open, so there are no facilities, for going to the loo or for washing your hands or for getting a drink. So I think there's still some challenges there, but it's great to see so many courts filled and people playing singles. Singles had become a little bit a thing of the past, very much more doubles at recreational level. So seeing people out playing singles and running box leagues and ladder competitions and things has been really wonderful.
What about the professional game? No Wimbledon, sadly, of course, but we're hearing the US Open is still planning to go ahead this summer. Is that a right decision?
Well, I think they're waiting for government approval, but I think you have to take your hat off to the USTA, they've taken into account every possible scenario to try and get the event running, because of course it's a massive revenue earner for US Tennis Association. That's where most of their revenue comes from on an annual basis. So it's really important to them. But I think, for me, it's, every country's at a different stage of this virus, and, different restrictions, different quarantines, different international travel opportunities, etc. And of course, there's still no vaccine. So, I think it's, for me, it just feels like it's a little bit risky, but it is still a couple of months away, and a lot can happen in that time for the better or for the worse. So we'll just have to wait and see.
All right, Judy, thank you so much for talking to us. Judy Murray there, good to talk to you. Now, as we've been saying, Boris Johnson is going to lead today's daily briefing on coronavirus inside Downing Street, starting in just a couple of minutes' time. Let's go to our political correspondent, Chris Mason, who's going to be watching and listening to it and analysing it for us afterwards. Well, they've got plenty to talk about in terms of that drug that we've been discussing that's going to be a big help in treating people who are seriously ill with coronavirus. But first, let's talk about that U-turn by the government, by 10 Downing Street, on school meal vouchers, prompted by Marcus Rashford and that campaign. Just bring us right up to date on what's been said on that, Chris.
Yeah, evening to you, Ben. Loads of news around today. As you say, I think a lot of the focus of the news conference will be on this drugs breakthrough. One of the professors involved is amongst the cast list alongside the Prime Minister. Then we've had the news of the scrapping of the Department for International Development. And then this change of heart from the government in England on providing vouchers to ensure poor children are properly fed over the summer holidays, which are not that far around the corner. After that campaign from Marcus Rashford, you might have seen him talking to Sally Nugent on BBC Breakfast yesterday morning. We've just had this reaction to the government's U-turn from Sir Keir Starmer, the Labour leader.
I think the government's got it completely wrong. It was obvious that there was a need for these free school meals. They should never have put that in jeopardy. We had to push them all the way, and Marcus Rashford played a really important part in that. But I welcome the fact there's a U-turn. That's the right thing to do. And so now 1.3 million children who need free school meals will get them.
A sense there, Ben, of the scale of this, the number of children that will benefit, a significant number now able to be sure that they'll be able to have these vouchers over the summer. Adds up to around about £15 a week. These vouchers will be redeemable throughout that 6-week summer holiday period. We've seen similar announcements from the Scottish and Welsh governments as well. In fact, in just the last couple of minutes, Gavin Williamson, the Education Secretary in England, praising Marcus Rashford, describing him as the best of Britain in leading this campaign. It was becoming increasingly inevitable, to be honest, as this morning trundled on, that given the vociferous
Chris,
nature...
Thank you, because the Downing Street briefing is beginning, and here is the Prime Minister, Boris Johnson.
Good evening. I'm delighted to be joined today by the Chief Scientific Advisor, Sir Patrick Vallance, and by Professor Peter Horby from the University of Oxford's Centre for Tropical Medicine and Global Health. Today, I'm actually going to let them do most of the talking as they have some news to share on a new treatment for coronavirus. But I will start by updating you briefly on the latest data. The first slide, please. We've had 6,981,493 tests for coronavirus carried out or posted in the UK. This includes 113,107 carried out or posted yesterday. Of those, 298,136 have tested positive, an increase of 1,279 cases since yesterday. The second slide shows the latest data from hospitals. 410 people were admitted to hospital with coronavirus in England, Wales and Northern Ireland on the 13th of June, and that's down from 438 a week earlier and down from a peak of 3,432 on the 1st of April. 385 coronavirus patients are currently in mechanical ventilation beds in the UK, down from 513 a week ago and down from a peak of 3,301 on the 12th of April. The third slide shows what's happening in hospitals across the country. There are now 5,254 people in hospital with coronavirus in the UK, down 16% from 6,282 a week ago and down from a peak of 20,698 on the 12th of April. The fourth slide shows the daily figures for those who have sadly lost their lives after testing positive for coronavirus. And across all settings, the total number of deaths now stands at 41,969, and that's an increase of 233 fatalities since yesterday. And although those figures are still very sad, they do show that we're making good progress in controlling the spread of the virus. Tests are up, cases are down, hospital admissions down, the number of patients overall in hospital and specifically those on mechanical ventilation beds, both down. And of course, while each death is one too many, deaths, to repeat, are coming down too. And that progress has, of course, only been possible thanks to the dedication of the British people as we work together to beat this virus by observing the lockdown, sacrificing contact with friends and families. Everybody has played their part in bringing the virus under control, so it's critical now that we hold our nerve and don't throw away the progress that we've made. On the 11th of May, I set out the plan to help our country to recover, and step by step we're working through it carefully and deliberately, and at each stage we have only proceeded when the evidence suggests that it's safe to do so, ensuring that our 5 tests for adjusting the lockdown continue to be met. And yesterday it was great to see our shops open their doors again. Our retail sector, I think, has done a fantastic job making sure that they are COVID secure, meaning they can open in a way that's safe both for staff and for customers. And it was great to see so many people out shopping whilst observing social distancing, quite a lot of them. And that is so important for stopping the spread of the virus. It's also been very good to see more and more children coming back to school this week. Some secondary pupils now returning for face-to-face contact with their teachers ahead of the exams next year. But I want to say to all parents whose children are eligible to return in primary school, and there's loads of them, I want to assure you it is safe, and there is no need for your kids to miss out on their education. I hope they will go to school. I know that people want us to go further with our changes to the social distancing measures, and I'm all too aware that the 2-metre rule has big implications for schools and for many other sectors. And I want you to know I absolutely hear those concerns and will do everything in my power to get us back to normal as soon as possible. But we must proceed carefully and according to our plan. And I'm still committed to that central goal, to get back to life as close to normal as possible for as many people as possible, as fast and as fairly as possible, in a way that minimises the risk of a new epidemic, minimises the risk to life, and maximises our chances of a strong economic and social recovery. So our plan sets out the next step for adjusting lockdown. You may remember for personal care, for the hospitality and leisure sector, for gatherings in places of worship, other public places, a lot more to come. And that, as you know, will happen no earlier than July the 4th. And we remain absolutely committed to that plan, and we'll say more about how we are going to be taking it forward. But today, there's other news, because the global efforts to find a long-term solution to the pandemic continue, whether that's through a vaccine or treatment. And I'm absolutely delighted that the biggest breakthrough yet has been made by a fantastic team of scientists right here in the UK, and I'm not really qualified to pronounce on this drug and its effects, but I'm going to ask Sir Patrick and Professor Horby to say more in a moment. But I am proud of these British scientists, backed by UK government funding, who have led the first robust clinical trial anywhere in the world to find a coronavirus treatment proven to reduce the risk of death. And I'm very grateful to the thousands of patients in this country who volunteered for the trials. Thank you. This drug, dexamethasone, can now be made available across the NHS. And we've taken steps to ensure we have enough supplies, even in the event of a second peak. Of course, while the chances of dying from COVID-19 have been greatly reduced by this treatment, or significantly reduced by this treatment, they're still far too high. So we must redouble our research efforts, and we certainly will. But today, I think that there is genuine cause to celebrate a remarkable British scientific achievement, the benefits it will bring, not just in this country, but around the world. And I'll now hand over to Sir Patrick.
Thank you very much, Prime Minister. So the way in which we find out whether drugs work is through clinical trials, and I think this is an extremely good example of a clinical trial that's been very well conducted, has had large numbers of patients enrolled across the UK, and Peter Horby, who has led the study, will say more about it in just a minute. It's called the Recovery Study, and I just want to send a few moments to sort of thank some of the people involved. I'd like to thank the investigators who have put this together and led it so effectively, all of the people in the NHS who've been part of actually making this happen. Of course, the funders who allowed this to happen, that's both the MRC and the National Institute of Health Research, NIHR. Actually, thank some of the other people involved behind the scenes as well, such as Jonathan Van Tam, and most importantly, the patients who volunteered to be part of this study. But rather than me talk about it, it's much more important to hear from Peter Horby, who led this and really has driven the whole thing through. Peter.
Yeah, thank you very much. So I'm co-chief investigator of the Recovery Trial with Professor Martin Landry, and we've been supported by an absolutely fantastic team in Oxford and also across the entire NHS, because the trial has been implemented across all countries in the United Kingdom, more than 175 hospitals, with tremendous efforts by NHS staff who are under enormous pressure to actually talk to patients, tell them about the benefits of getting good clinical trial evidence to make sure we have the best treatments and getting them into the trial. And I think we've broken some records. So in 3 months, we've enrolled over 11,500 patients. So this makes it by far the biggest clinical trial in the world. And we've been testing 6 different drugs. A couple of weeks ago, we declared an answer on hydroxychloroquine, showing that in hospitalised patients it doesn't work. And this week we've got some news on dexamethasone, which, as we've heard, is a steroid drug. It's an old drug. Some people would say it's a very boring drug. It's been around for 60-odd years. It's very cheap. It costs pounds, and overseas it costs pennies. And so we closed that arm of the trial on Monday, the 8th of June, because we had enrolled more than 2,000 patients on dexamethasone, and we compared them to 4,000 patients who had standard of care. And what we saw was really quite remarkable. So we've looked at different treatment groups, and the drug has a different treatment effect in different treatment groups. So in ventilated patients with COVID-19, the drug dexamethasone, so 10 days of treatment with that, which is a tablet or an injection, reduces the risk of death by about 35%. In patients on the ward who require oxygen and have COVID, it reduces the risk of death by about 20%. That covers about 75% of patients in the hospital who will receive a mortality benefit from using this drug. There's another group of patients who don't require oxygen but have COVID, and we did not see a benefit in those patients. So it's not a drug that you would use in the community or in outpatients or in patients on the ward who didn't have breathing difficulties. But in patients with breathing difficulties who require oxygen or ventilation, it really is showing quite a significant effect. And it's really important because the drug itself is very widely available. It's on almost every pharmacy shelf in every hospital. It's available throughout the world, and it's extremely cheap. So we've looked at the numbers, and if we treat 8 patients in intensive care with this drug, we'll save 1 life. And the total cost of treating all 8 patients is only about £40. So this is really, really remarkable, and we're extremely pleased with this result. We're continuing with the trial because we have still 4 other drugs in the trial. And what we hope is we can build on this very strong foundation with adding additional drugs and continue to bring down the case fatality rate. And so I think this is a really good news that we've now got a treatment that almost every patient can take, and they will get benefit from it.
I'll just add a couple of things to that. The important thing is this is the first medicine that's been shown to reduce death in any group with COVID, and that's the start of something. So it shows this is possible to do, and as other drugs get looked at, the hope is that they'll add on top of that, and you'll add beyond the 25 or 35% change that Peter's talked about. So this is the start of something important. It shows it is possible to reduce the inflammation and the outcome in patients with lung disease in hospital, and it's the start of other drugs which might be added on top of it to make an even bigger effect in due course, we hope.
Thanks very much, Peter and Patrick. And We're going to go now to questions from the public. So can we go please to Trevor from Northamptonshire?
With the World Health Organization and other countries opting to have a social distance of 1 metre, when will the government move from 2 metres to 1 to be in line with these countries?
Thanks very much, Trevor. And I think that's the question that obviously I'm being asked the whole time now. As you know, the advice is that 2 metres is more effective at reducing the risk of transmission of the virus between us, and that's why we've been going for 2 metres. Lots of countries go for 2 metres. That's the advice that we've had from our scientists. But it's also my view, and I think an increasingly widespread view, that as we get the numbers down and we get the rate of infection down in the country, then the statistical likelihood, Trevor, of any of us actually being next to somebody, whether 2 metres or 1 metre or whatever distance, who has coronavirus, is going down the whole time. So we are keeping it under constant review, and as we depress the numbers, as we reduce the incidence, I think we'll also have a strong case for reviewing those measures as well. And I hope to be able to do that, but I'm afraid to say we can't do it yet. We need to continue to make progress. Patrick, anything you want to say on
I think that's exactly right, Prime Minister. 2 metres is safer than 1 metre. But it's not an absolute, it's a relative, and obviously the closer you get, the riskier it is, so it's a risk assessment. And as we've said in the evidence that we've given scientifically, that there are things you can do to reduce the risk on top of that, including being side by side rather than face to face, back to back, in a good ventilated space. The risk is lower outside, and face coverings can help when you're in crowded spaces where you can't avoid, but to be close to somebody. So there are times in which this can be changed, and that evidence, of course, can then be the basis of a policy decision on what the right distance is that should be mandated or put forward as the rule to follow. So I don't think 2 metres is some sort of absolute cut-off that never changes. And as the Prime Minister said, when you look at the incidence, the number of people getting the infection every day, or the prevalence, the number of people with the disease at any one time, which currently, according to the ONS numbers, are something like 6 out of 10,000 people have the infection at the moment. You can see the probability gets quite low, and therefore you can start to think about ways in which you can manage the distance in certain circumstances in different ways.
Absolutely. Peter, anything you want to add on the 2 metre rule from the point of view of okay, good. Well, look, Trevor, the answer is, we're getting there. Please, people, I know people are very, very impatient about this. We're making as much progress on that as we can, and watch this space, because we absolutely hear you. Can we go to Terry from Hawley? And Terry says, the latest funeral advice and recommendations were provided on May the 18th. Can you provide an update to these, and have these been relaxed for mourners given the relaxations and easing of lockdown that have since taken place? Terry, what I think I can say is that we do think that people should be able to attend funerals, provided they observe social distancing and follow the basic rules. And I think that we totally understand on compassionate grounds why people need to attend funerals, and we'll be saying more about what we can do more generally to relax social distancing rules as we come up to July the 4th. Patrick, anything you want to say more on funerals? Thanks very much, Terry. Can we go to Vicky Young of the BBC, please? Vicky.
Prime Minister, you've talked a lot about levelling up and tackling inequalities in Britain, but it's taken a campaign by a 22-year-old footballer to force you into action on free school meals. Have you lost touch with those that you promised to help? And I've also got a question to Sir Patrick Vallance about dexamethasone. Could this treatment mean that in future, if there were to be a second wave, that we might not need to take such extreme lockdown measures?
Thanks very much, Vicky. Well, actually, I talked to Marcus Rashford today and congratulated him on his campaign, in which, to be honest, I only became aware of very recently today. And I thank him for what he's done. I think he's right to draw attention to this issue. Basically, we've got large numbers of kids who haven't been able to get back into school. We've got a problem about getting kids back into the school in the way that we would want, for the reasons that people understand. Though actually there are lots of kids who could go back to school now who aren't going back to school, and I'd like to see that. I'd like to see that happen. But I do think it's right that we should be looking after families of the vulnerable, most vulnerable, the neediest right now, and that's why we've got the COVID summer food plan, which we've announced today, and I hope it will make a big difference to those kids and to those families. Can we go to? Oh, sorry. Yes. Yeah. Sorry.
Peter may want to come in on this, but just remember, this drug doesn't stop you catching the disease. It doesn't stop you going into hospital with the disease. It reduces the death for those who are in hospital who require oxygen, or in ICU and require oxygen. And it's a very important effect. But as Peter said, it's roughly 1 in 8 who survive as a result of this. A very important effect, but certainly not an effect size that would say, well, therefore you don't need to worry about the other measures to try and reduce the spread of this infection. Peter, do you want to add to that?
Yes, I mean, I would add to that. It's great to have an effective treatment, but we need to build on that. We still, I think, have got some room to improve the survival rates quite markedly, but it's only part of the measures to control this disease. We also need very good vaccines, and if need be, to reintroduce social distancing measures if we see transmission increasing again.
Thanks, Vicky. Can we go to Dan Hewitt from ITV?
Thank you, Prime Minister. 2 questions, if I may. The first, we're in Smethwick today, filming with families who are reliant on the free school meal voucher scheme that you set up. 3 of the families have said to us they remember you specifically saying that you would do whatever it takes to help them get through this crisis. You've just said it's the right thing to do to help the neediest families to introduce the scheme over the summer. But why did it take a 22-year-old footballer to embarrass you into changing your policy? And secondly, if I may, how can you reassure your old friend David Cameron that merging the Foreign Office and DFID won't, as he says, cause less respect for the UK overseas?
Well, Dan, first of all, on the summer food support scheme, I think it is, as I say, I think it is the right thing to do, and I do congratulate Marcus Rashford on his campaign. And we set out a voucher scheme for the first couple of holidays. Clearly, free school meals should generally apply in term time. That's what that's what they're there for. But we have to understand the pressures that families are under right now, and that's why we've responded as we have. And as I say, I think it's the right thing to do, and it will help the kids from the families that really need it. And on your second question about what we're doing with DFID, well, look, I mean, I think we've got to be. This is a fantastic opportunity for this country to make the most of our enormous influence abroad and maximise the UK's projection by merging DFID and the FCO. And frankly, I think it's extraordinary we haven't done it earlier. We have 28 out of 29 OECD countries do it this way. It's far more coherent. It means that the sums that we spend on aid are used not just to tackle poverty, deprivation around the world, but they're far better in line with UK government policy and the priorities of the British people. And I'm absolutely certain it's the right thing for our country right now. And think of things like the coronavirus vaccine summit, the Gavi summit that we held just the other day. It was a fantastic example of the UK leading in helping to raise $8.8 billion dollars, $8.8 billion to come up with a vaccine, not just for coronavirus, but to help vaccinate kids around the world and solve all sorts of problems. So what we're trying to do is put that idealism and that mission to improve the world, to save kids, to encourage female education at the heart of UK foreign policy. And we're creating a new Whitehall super department that will actually, I think, enable us to express our views much more powerfully around the world. It would be good for development aid and good for the UK, and it's the right time to do it. Sam Coates, please, from Sky.
Thank you, Prime Minister. To Patrick Vallance and Peter Hornby, on demoxydazole, how quickly can people in the NHS who are suffering breathing problems expect to get this treatment? Is there an expectation that it will be available pretty much now for anybody who needs it in the UK? And Prime Minister, we understand that this drug has been put on the government's export ban list, which means that companies can't buy it up and export it to other countries. On the day that you've given a speech about global Britain, that doesn't feel very global Britain to me. Can you explain the rationale behind that decision? And as part of your decision to merge the International Development Department and the Foreign Office, you seem to signal a very big shift in foreign policy, taking aid money away from Zambia and Tanzania and giving it to relatively rich countries like Ukraine. Can you just spell out a bit more of your thinking behind that surprise decision, and why was that now?
Well, first of all, on what you're saying about dexamethasone and the ban on exports, I'm not aware of that. Patrick, are you aware of any? I'll have to come back to you on that. Sam, but it sounds. I mean, dexamethasone, as I understand it, is a drug that is produced around the world. I mean, and perhaps Peter and Patrick might like to comment on this, but it's produced very cheaply in India. It's produced in Thailand. It's produced. I think it was first identified in 1957 a steroid. So it's been around a long time. I'll have to come back to you on your suggestion that we ban the export of dexamethasone. It sounds peculiar to me, but we'll certainly look into it. On your question about reprioritization of aid budgets, no, that's not what's happening. That's not what's happening. What we want to do is to make sure that we get better bang for our buck. The British taxpayer spends a huge amount on aid, and quite frankly, in my view, as somebody who observed things very close up, I'm a huge fan of what DFID has done. I'm a massive admirer of the dedication, idealism of our aid professionals. But what I want to see is greater integration of that passion and that commitment with our overall foreign policy objectives. And we can do that, and we can make much more difference around the world if we act as one global Britain with one focal point in the countries where we're represented, and we're represented obviously around the world, with the ambassador in that country leading and really conveying a single message from the United Kingdom about our priorities, whether it's female education or human rights or whatever it happens to be. And that is the way to get more bang for our buck. I passionately believe that it's the right thing to do, and this is the right time to do it. All the other countries are going this way, even if they previously had separate aid departments. They've been folding them in, and now is the time for us to create this really powerful, unified voice for international policy. I think there was a question for you, Patrick. Sorry.
And I'm bringing Peter as well. But I mean, the first thing to say is dexamethasone is inexpensive, very widely available. And the really exciting thing about this study is not only that it works, but it means it can work across the world. This is a change of practice. It doesn't require complex manufacturing owned by one company that can't produce it in scale. This is a drug which can immediately be used across the world for this condition, and that's such an important thing. And your question was, what are we doing here? And the CMO will be issuing guidance to say that this should be used for clinical practice, and that's what I expect to happen shortly as he releases his guidance. So the idea is to get on with this and certainly to try and make this as available as possible everywhere in the world, which is part of the excitement. I don't know, Peter, whether you want to add anything to this.
No, I mean, it's of all the drugs in our study, it's the one that I'm most excited about and most pleased that we've got this positive result, because it's very stable. We know it extremely well. It's been used for 60 years. It's in the cupboards now. You know, the doctors can walk across to the pharmacy cupboard in 5 minutes and they can prescribe it. They know how it works and they know it's going to help. And so it can be done this evening. It's fantastic.
Thanks very much. Jason Groves, Daily Mail.
Thanks, Prime Minister. 12 weeks or so ago, you stood in that room and predicted we'd have sent the coronavirus packing in 12 weeks. Just for lots of people, it doesn't feel like that. People can't send their kids to school. They can't hug their loved ones. Even you can't get a haircut. Are we going to have cracked it in another 12 weeks? And can I ask on a personal note how Wilfred is getting on? Is he keeping you awake at night? Has he seen his grandparents yet?
Well, look, Jason, look, first of all, actually what I said was that we were going to turn the tide within 12 weeks. That's what I don't hesitate to correct an illustrious correspondent such as yourself. But I said we would turn the tide, and I really think we did. Within 12 weeks. If you look at where the disease is now, we went through the peak. We've flattened the sombrero, whatever I said we were going to do. We did that. I think that as a result of the actions that the British people took, we saved many tens of thousands of lives at the least, and we're coming through this. Of course, it's a very difficult time for this country, but we are coming through it. And yes, I do think that we're now starting to see with, drugs like dexamethasone, the idea that perhaps you could combine that with, with other things. We're seeing the first chink of light, which I was perhaps a bit dubious about. We're seeing the first chink of light, and the hope that there will be preparations, treatments, there already are, that can make a big difference to mortality rates. And as you know, we're making big investments in vaccines. Now, all of that, none of that negates the importance of us continuing to follow the rules, to control the virus and save lives. And I think people do understand that. We've turned the tide on it. We haven't yet finally defeated it. And that is the reality that we have to face. I think people do accept that, but I also think people are absolutely resolved to defeat it. And I can assure you, Jason, that we will. And as for your other question about Wilfred, well, I never normally comment about these sorts of things, but it's all fine so far. Thanks, Jason. All doing well. I think that was Jason's only question, wasn't it? I think. There are no scientific questions there. Let's go to Sophia Slay from the Evening Standard. Sophia.
Thank you, Prime Minister. My first question is for the scientists. The Evening Standard understands that there is a huge demand for data from post-mortem tissue samples of coronavirus victims. Would you encourage more post-mortem research and encourage families to give their consent? And my second question is for the Prime Minister. Spain says it's considering imposing quarantine restrictions on UK visitors unless the British government lifts its own 2-week isolation rule. What is your response to Spain today? And secondly, will you be talking about a travel corridor with France when you see President Macron later this week?
Thanks very much, Sophia. Sorry, the question, do you want to address the scientific question first, Patrick?
Well, clinical research in all its forms is incredibly important for this disease. It's a new disease which we are trying to learn about. I think the example of the recovery study, which Peter and Martin Landry have led so effectively, is an absolute landmark in understanding where something could make a difference. And clinical research in all its forms can involve taking blood samples, it can involve taking tissues in order to understand what's happened to the tissues to pick up virus. It can involve x-rays and scans and other things to look at it. And it also involves the use of post-mortem tissues sometimes in order to understand more about the causes of death and the way in which the virus can affect different organ systems. And so that is an important part of understanding this disease and has always been an important part of understanding new diseases, understanding old diseases better, and trying to make sure that the treatments are therefore targeted in the right way. So post-mortem research is a part of an important part of the research system, but there are many, many other parts as well. Peter, do you want to add to that?
No, I would completely echo that. This is a brand new disease. We're learning, every day, but there's still so much we don't know. We still don't know how it affects the blood vessels, how it affects the heart muscle, how it affects the nervous system. We really need to understand that properly to really make progress. And I think, there's many contributions that people can make, and agreeing to postmortems is one small way that they can make a contribution to other patients.
Thanks very much. Just to say, obviously, I'll be talking to Emmanuel Macron about all sorts of ways in which we can bring our countries together, making sure that we eventually will be able to travel freely to and from each other's countries. Same goes obviously for Spain as soon as we can. The reason for having the quarantine system is very simple. It's we don't want to re-import the disease just at the moment when we've really got it under control in this country. But we're certainly looking at air bridges and ways to ensure that people can safely go on holiday eventually. Daniel Barnes from the South Wales Argus.
Thanks, Prime Minister. Yesterday, Welsh First Minister Mark Drakeford said in his briefing that he'd not spoken to you for 3 weeks. Does this lack of communication explain why you've been unable to maintain a consistent four-nation approach during this pandemic?
Well, Daniel, actually, we've done a huge amount of collaboration and conversation with Mark and with leaders in all the nations of the UK. And actually, I think that, as I've said many times before, there's far more that unites us than divides us. Welsh Government ministers, ministers from Scotland, Northern Ireland, they've been at all the COBRA meetings. They're talking continuously to Chancellor of Duchy of Lancaster, and I look forward to talking to Mark as soon as possible. But while you're on, Daniel, I might just say from the South Wales Argus, I might just say that the people of Cardiff were amongst those who really volunteered in large numbers for the trial that enabled the dexamethasone that enabled the dexamethasone trial to be successfully completed. So a big shout out and a big thank you to the people of Cardiff for their volunteering. Would that be right, Peter?
Yes, I mean the whole trial has been a huge effort across all the four nations with fantastic recruitment. Our top hospital was in Leicester, but we had fantastic recruitment from Wales and Scotland and Northern Ireland as well. So it's been a huge national effort.
Good. Thanks very much, everybody. Thank you, Daniel. Thanks all. Thank you.
So the end there of that latest coronavirus Downing Street briefing led by the Prime Minister. Let's just take you through the main points that came out of that briefing there with Boris Johnson. And he announced what he called the biggest breakthrough yet in finding a coronavirus treatment proven to reduce the risk of death. The treatment is that steroid dexamethasone. It cuts the risk of death, we heard, by a third for patients on ventilators. And for those who are on oxygen, it cuts the rate of deaths by a fifth. Now, the Prime Minister said the UK does have enough supplies of dexamethasone, even in the event of a second wave of infections. It comes as another 233 people have died in the UK from COVID-19. That takes the total death toll so far to 41,969. So let's talk to our political correspondent Chris Mason, who's at Westminster, who's watching and listening to all of that. Good news on dexamethasone, but let's just talk about the politics of school meal vouchers in England. And the Prime Minister pressed a couple of times on why the government had changed policy on this because of a 22-year-old footballer.
Yeah, and we learned, didn't we, that the Prime Minister has just come off the phone to Marcus Rashford. It's our understanding that they spoke as the Prime Minister travelled back from Downing Street, where he was talking about Whitehall reorganisation and the scrapping of the Department for International Development, heading back to Downing Street for that news conference. At some point between those two events, Mr Johnson spoke to Marcus Rashford. Intriguingly, I noticed that the Prime Minister said that he had talked to Marcus Rashford today. He congratulated him on his campaign, which, to be honest, he said, I'd only become aware of very recently, today. And I thank him for what he's done. Marcus Rashford has been talking about this for some time. He published that open letter yesterday morning, gave an interview to Sally Nugent on BBC Breakfast yesterday. And Downing Street actually said to us yesterday that the Prime Minister would respond to Marcus Rashford's letter. That was something we were told yesterday, and yet the Prime Minister saying today he only became aware of the campaign today. Nonetheless, this government about turn and this decision that there will be vouchers provided for children in England who are recipients of free school meals over the summer to match what happened during the Whitsun half-term break and also at Easter. A couple of other news lines that I spotted, Ben, in that news conference. I thought that Sir Patrick Vallance, the Chief Scientific Advisor, offered potentially a little bit more scientific cover for what we expect will be a switch at some stage around the 2-metre rule, acknowledging that there are mitigating ways to manage the risk assessment, as he described it, around getting closer to one another than 2 metres, including, for instance, sitting back to back, whether that be on, for instance, public transport or in a work environment. Then the news, as you say, about dexamethasone. So, yeah, when the Prime Minister turns up at these news conferences, there was a greater likelihood of news. And I think it was quite striking that there was quite a bit tonight. Worth just emphasising, though, I thought, that Professor Peter Horby saying that, look, this drug breakthrough is not a panacea because ultimately it's only going to help you if you're pretty seriously ill with COVID-19. It wouldn't reduce the number of people who end up in hospital if there is a second wave. It would only treat those, and potentially only some of those successfully, who are pretty seriously ill and require assistance with breathing, and so wouldn't necessarily restrict the extent of any future lockdown if there was a significant second peak.
Yeah, and just on the 2-metre rule, I also thought the Prime Minister, just sort of reading between the lines a little bit on that, as you say, perhaps paving the way for a reduction of the 2-metre rule to a 1-metre rule. He said sort of watch this space, and he also said there's a strong case for reviewing the measures.
Yeah. So I think what you saw there from the Prime Minister is genuine conflict at the heart of government, because they are desperate to avoid a second wave for all of the obvious medical and economic reasons that would be the consequences of a big second peak. But at the same time, they're very alive to those, particularly in the hospitality industry, looking forward to potentially reopening of pubs and restaurants and cafes at the beginning of next month in England, that plenty of them say, look, at 2 metres we're not financially viable, at 1 metre we can make it work, we can make money. So I think the government's very alive to both of those realities, conflicted between the two, given what the medical evidence suggests, and therefore taking a look at both sides of the ledger, the economic and medical side of this, and hoping that if the reproduction rate of the virus remains below 1, in other words, it is shrinking and the number of cases are shrinking, that you can make a more plausible case for reducing it to 1 metre, because the likelihood of any of us encountering somebody who has the virus in that instance is shrinking.
All right, Chris, many thanks. Lots of talking points. Good to talk to you. Chris Mason there, our political correspondent. Well, Cornwall is being hit hard by this pandemic because of its reliance on tourism and hospitality. Now, the County Council fears that more than a quarter of jobs in Cornwall are currently at risk. Newquay is particularly vulnerable. 2 hotels there have already permanently closed their doors. Our social affairs correspondent Michael Buchanan has this report.
It's belonged to Shearing's Holidays, but actually it didn't. It belonged to us. We cared for it. It was all of our lives.
Welcome to the Beresford Hotel. But in lockdown Britain, these aren't staff and guests, but former employees laid off when the company went under last month. Life was lived here, busy and bustling. No more. Receptionist Caroline Tansley would often lead the entertainment.
Everywhere would be packed, and it's just dead, really. And to see the hotels just standing empty is just heartbreaking.
In the abandoned kitchen, chefs Philip and Andrew are among the 50 staff made redundant when the company behind Shearing's Holidays called in administrators. They loved it all: their guests, their colleagues, their jobs.
It's
who actually have no security now and no jobs actually in the area as well is actually very hard to swallow. You know, you feel like your pride's been taken away a bit.
I'm a reasonably confident person, but this definitely has sort of knocked a little bit of the stuffing out of me.
Cornwall fears an economic crisis because of coronavirus. A council report says over 70,000 jobs could be at risk. That's more than a quarter of all jobs in the county. Everything's affected. Fishermen can't sell to restaurants that don't have visitors who aren't filling hotels.
I'm not sure that I would employ me at my age.
The Beresford's general manager, 63-year-old Jackie Cunliffe, says job hunting at this time is daunting.
Our assistant manager applied to Aldi, and they said after 500 applications they weren't looking at any more. So everybody's going to have the pick of the perfect candidates.
There is some hope that a new owner might emerge, but for newly unemployed sisters Diana and Catherine, life has more immediate concerns.
We've got a few savings, but I've just found out my husband's just been made redundant, so that's going to hit us big time.
Staff here thought themselves a close, supportive family, but the pandemic is shredding those bonds. They're individuals now, facing a harsh economic climate. Michael Buchanan, BBC News, Newquay.
Parents of severely disabled children say they feel forgotten during lockdown. New figures from the Disabled Children's Partnership suggest that in 76% of cases, disabled children and their families have been surviving since March without any of their normal care and support. Ellie Costello reports.
This is Spike. At 9 days old, he had a heart attack and a stroke. He suffered severe brain damage. He has cerebral palsy, is epileptic and is deaf, so has very limited communication. Since the start of lockdown, Spike's mum has cared for him alone. She is just one of the many parents in the UK in this difficult position.
The Disabled Children's Partnership has surveyed more than 4,000 parents of kids with complex needs. More than 3/4 of those families say that all care and support has been withdrawn since lockdown began. The majority of these parents report worsening mental and physical health of not only themselves, but of their children.
We've kind of had to just wing it and make it up as we're going along, really. You know, I received this letter saying that he's been identified as vulnerable, you need to shield him. There was no guidance in that at all. So I then get to a point 8 weeks later that I'm absolutely on my knees and just begging for help.
Aside from the emotional strain, 1 in 5 families said they will go into debt as a result of caring for a disabled child during the pandemic. Rachel Wright made the decision to pay for a private carer to move in with her family during lockdown. Her 14-year-old son Sam has severe cerebral palsy and is blind. He can't walk, he can't talk, he can just about scratch his nose. Prior to lockdown, 10 people helped to care for Sam. Rachel managed alone for 2 weeks, but it became too much.
There are safeguarding issues. As a nurse, I go to work and I can't work more than 14 hours. I can't work more than 12 hours without legislation and regulation saying I can't. I certainly can't work 14 days in a row and be deemed safe in my practice. Yet, as a parent of a child with complex needs, I'm making decisions about medications, I'm making clinical decisions about seizures.
In response to claims that some parents are working hours that would be officially deemed unsafe, the government told us that they're working to support the safety and well-being of those with special educational needs and disabilities. They say, we've also made £10 million available to help families through grants for equipment to make their lives easier. Ellie Costello, BBC News.
All schools have been ordered to close again in the Chinese capital, Beijing, as the city tries to contain a new coronavirus outbreak. An official has described the situation as extremely severe. Our correspondent Stephen McDonnell has the latest from Beijing.
I mean, on the one hand, you've got the raw numbers. Now, they're saying that over the last 5 days, there are just over 100 cases from this outbreak. of people who've been confirmed with the coronavirus and have symptoms. And that yet you have this official saying that the situation is extremely severe. Now, in other countries, people will be thinking, that doesn't sound very severe to me, just over 100 cases. But the point is, in Beijing, there were no cases for more than 50 days, and now there's this local outbreak that's happened. Unlike these other examples of people who've been infected who've come back from overseas into the country, this is like a domestic outbreak of infection. And so either the numbers aren't reflecting what's really happening on the ground, or officials here have just decided they are going to crack down very hard on this and make sure that they've stamped out the coronavirus before it can really take hold here, and they'd have to shut down Beijing. So they're taking this very seriously, and I think the fact that it started at a market, at a wholesale market, which has such wide exposure throughout the whole of the city, is one of the main reasons why they're concerned about this outbreak.
Stephen McDonald reporting there from Beijing. South Korea has strongly condemned the destruction by the North of a liaison office built to facilitate peace talks. The office was set up 2 years ago at South Korean expense in the North Korean border city of Kaesong. The move comes just hours after the North renewed threats of military action at the Korean border. Our Seoul correspondent Laura Bicker reports.
This building was a symbol of hope. Within seconds, it was reduced to rubble. In the north, viewers were told that it was a terrific explosion. In the south, the mood was more sombre.
We sternly warn that we will respond strongly if North Korea continues to take measures to aggravate the situation.
2 years ago, in a wave of optimism, the leaders of North and South Korea met. They agreed to work together to find a path towards peace. They opened a newly refurbished liaison office to aid talks. But relations soured after Kim Jong-un met Donald Trump in Hanoi. The two couldn't come to a deal to dismantle the North's weapons. There was no triumphant return to Pyongyang for Mr. Kim, and no sanctions relief for his impoverished state. The North is also angry that defectors in the South continue to send anti-regime propaganda in balloons over the border. But it's likely that current tensions are part of a bigger plan to pressure Seoul. The North Korean military is now threatening to head back into parts of the heavily fortified border. The South Korean army is once again on alert. President Moon had hoped holding hands with Kim Jong-un would lead to irreversible peace on the peninsula. Pyongyang appears ready to prove him wrong. Laura Bicker, BBC News, Seoul.
President Trump has signed an executive order aimed at reforming some police procedures. The move follows a wave of protests which have swept the United States since the death of George Floyd 3 weeks ago. Mr. Trump said that police will be banned from using chokeholds in future unless their lives are under threat.
What's needed now is not more stoking of fear and division. We need to bring law enforcement and communities closer together, not to drive them apart. Under the executive order I'm signing today, we will prioritize federal grants from the Department of Justice to police departments that seek independent credentialing, certifying that they meet high standards, and in fact, in certain cases, the highest standard. That's where they do the best, on the use of force and de-escalation training. For example, many believe that proper training might have prevented the tragic deaths of Antoine Rose and Botham Jean. As part of this new credentialing process, chokeholds will be banned, except if an officer's life is at risk.
Here, there's a new warning today that the coronavirus pandemic has severely affected some young people's mental health. Research from the University of Oxford says primary school children have been most badly impacted. Hannah Gray reports.
scared about the coronavirus. I get really afraid that my family and I might get it, as a lot of people have died from it. It's really scary because everyone is talking about it, and people are sharing stories every day on social media. I don't know how to cope.
I'm really scared of my dad, especially when he's been drinking. Sometimes he gets really angry and throws things at my mum. It's been getting worse since the coronavirus started. I have no idea what to do. I can't escape because of the lockdown.
These are examples of the kind of calls Helen has been hearing since March. She works for Childline and she's really concerned about children's well-being.
I think children are the hidden victims of this coronavirus, and for many children, home isn't a safe place. And, you know, we haven't got community eyes and ears, schools, health services looking out for children. So that is a real worry.
People are dying, people are getting ill, and you can't see your friends, your relatives.
Sarah is 11 years old. During lockdown, she's done a survey asking 162 children in South Yorkshire how they've been coping.
Lots of people were actually worried, scared, and concerned about coronavirus. That was 82%. It was a very big thing to go through as a child, and yeah, it affected me quite a lot because I was worried what it could do to my family.
Her dad is a doctor at the local hospital, and he inspired her to talk to others about their feelings.
It's very important that we as children get our voices heard so that we feel calm and we know that it's safe. Because when you're very young, you can get very worried about things that completely change your life.
A new survey from the University of Oxford asked 10,000 families across England to report on their child's mental health. Secondary school-aged children say they're less stressed and behave better out of school, but primary school-aged children seem to be finding it more difficult.
Parents are reporting that over the course of lockdown, children's emotional difficulties, so being clingy or worried or unhappy, and behaviour problems, so having tantrums, getting into arguments, or maybe not doing what their parents are asking them to over that month, those things have actually got worse.
Even before the pandemic, the Children's Commissioner said the current system is far away from meeting the needs of all the children who have mental health conditions. Psychologists now suspect there'll be an even greater number of children who'll need support after being isolated for so long.
It's our job as professionals, as government, as schools to make sure that there is enough support available. You know, these effects don't have to be lifelong, and it's important that we all take account of what children and young people are telling us, believe them, and give them the right support to emerge from this intact and able to go on and enjoy their childhood and adult lives.
In the meantime, children like Sarah try to find their own ways of coping as they watch the adults around them deal with the biggest change to our world in a generation. Hannah Gray, BBC News.
And the latest weather now with Chris Fawkes.
Hello there. Our weather is going to stay in an unsettled, showery kind of mood for the next few days, and that means we are going to see a mixture of sunshine and heavy afternoon thunderstorms, capable of bringing some localised surface water flooding. Aside from that, it will be quite warm, and often it will feel quite humid as well. Now, today is no exception. We've seen lots of warm June sunshine already for sure, but we are seeing lines of thunderstorms break out. Some nasty ones working across southwest England, some fairly slow-moving downpours towards the Brecon Beacons. Manchester again has been hit with some fairly lively weather earlier on today with some thunderstorm activity and storms as well expected across western parts of Scotland. These heavy showers capable of bringing 25 to 35 millimetres of rain in the space of just 1 hour. So there is a risk of some localised surface water flooding and spray on the roads. Now, many of those showers do fade away overnight, but again, it's going to turn rather cloudy and grey across parts of the northeast with some mist and fog patches, particularly around coastal areas, and it will continue to feel a little on the humid side as well as we head into Wednesday. Wednesday's another day where, for the most part, it's a largely dry start to the day, perhaps a few showers though for the northwest. As we head into the afternoon, that's when the showers really get going. And this time they'll be quite widespread, I think, across Wales, the Midlands and areas of southern England. Again, the heaviest downpours could bring us some localised surface water flooding issues. But then on Thursday, it could get quite nasty, I think. The winds are going to look something like this on Thursday. And hopefully you can see there's a line roughly around here where we're going to see the winds kind of bashing together, a convergence zone. And where that happens, we'll get a line of thunderstorms that will become particularly slow moving. And along that line of storms, well, we could see quite large amounts of rain, maybe 40 or 50 millimetres for some, falling in the space of just 2 or 3 hours. Although the amount of rain you get from place to place is going to vary, this is a day where we could see some localised surface water flooding problems building in once again. So showers and thunderstorms to watch out for. There will be some rain pushing northwards elsewhere. Temperatures still generally into the low 20s, and it continues to feel rather humid as well. But as we head into the weekend, there's no sign of the weather settling down, but it probably will turn a little bit fresher. Rain at times moving into the northwest, perhaps the driest and brightest weather towards the southeast of the UK. That's your weather.